How's everybody tonight? I need to hear a little bit of, I need you to vocalize a little. Good evening, Michael, say. Good, excellent, excellent. Let me just give you a little bit of information you need. There will be a discussion section tomorrow. Nikki is out of the country, but Michelle Bunker-Alberts is going to be there. She is a nurse practitioner at Alameda County Medical Center who works on food access issues and has been working with People's Grocery. So has a lot of insight into the food equity justice piece. Is Michelle here by any chance? No. Okay. Well, you'll fill her in then on what happened. So try to come. It's tomorrow, 6 o'clock, Barrows Hall 166. I had a session last week or the week before, and it's a great opportunity. It's usually just 10 or 20 people and a real, conversation. So if you're free, I strongly encourage you to come. Couple Google Hangout announcements. Bob Martins, who was here last week, his Google Hangout is Wednesday, the 7th at 1:30 p.m. Question submissions are welcome. Mike Calicrate's Hangout will be on Wednesday, the 14th at 3 p.m. And Kelly Brownell's Hangout will be on Monday, the 12th of November at 12:30 our time. So those will be up on B-Space. Also, mark on your calendars, the Wendell Berry event I told you about last week has been moved from this space to Zellerback, which is good news because it means that we'll all be able to get in all likelihood. But you should still get there early and get a ticket. And that is on Halloween at 4 p.m., but you'll be done before it gets dark. So anyway, I strongly recommend that event. I think it's going to be great. Something I keep forgetting to mention is, how many of you are on Twitter? Okay, that's interesting. Must be a generational thing. Anyway, if you're on Twitter and you're interested in this issue, my feed, I put out a link every day, at least one link every day to an interesting article, document, speech on food policy, food politics. But you can also get it by going to my fan page at Facebook. The same links appear there as well, or on my website. But anyway, I keep passing things around that I think would be of interest to you, and I don't know how to use B-Space. So if you want to follow up on that, that's a good place to do it. So get out your clickers. We have an attendance survey question. Do you support taxing, putting a tax on soda and other sweetened beverages? A is yes, B is no, C is not sure. And it's one of the issues we'll be taking up this evening. Today we're going to talk about a link in the food chain we haven't really paid much attention to yet in this course. We've really focused heavily on the production of food. And now we're going to look at how it is marketed to us. Which is a really important part of the food system. And by dollar amount, a huge part of the food system. More than $30 billion a year is spent marketing food to you, which is to say getting you to eat as much as possible. And it is remarkably successful effort, as we're learning. In recent years, though, increased attention is being paid to this whole part of the food system, with an eye toward finding the causes of the large increases in obesity and type 2 diabetes we've seen since 1980 or so. The whole issue about how food is marketed to kids in particular has emerged as a real flashpoint in the movement. And putting some checks on that marketing effort to kids has become a real priority in the food movement. And which is trying to sort of shift the debate to one that has been traditionally organized around the concept of personal responsibility and free choice toward this idea that we live in a food environment, and that environment strongly affects our eating choices and our behaviors in the marketplace. And our guest tonight is one of the main reasons that this critical issue is beginning to earn the scrutiny it deserves. Kelly Brownell is a professor of psychology at Yale and director of the Rudd Center for Food Policy and Obesity. Time magazine called him one of the leading warriors in the area of nutrition and public policy. Speaking as a journalist, he is one of the not-so-old elders I turn to when I'm writing stories in this area, as someone who can always give me a really useful perspective, study, statistic to help me understand what's going on. He's both a distinguished researcher and a fearless advocate, willing to take on the industry and speak truth to corporate power. He's been especially active on the issue of soda taxes, an issue where the soda industry has amply demonstrated its power, including right now in Richmond, of course, where there's an important ballot initiative about this that we'll talk about. And we will discuss that fight after Kelly's presentation. Please welcome Kelly Brownell.
Thank you, Michael. That's a really nice introduction, and from somebody who I admire so much, it feels especially good. Boy, I can imagine taking a class from Michael Pollan and Alice Waters and what that must feel like. So what a wonderful opportunity you guys have, and it's a real pleasure for me to be here. I teach a class at Yale that's about this size every other year called the Psychology, Biology, and Politics of Food. And we cover a lot of the same issues, although we have somewhat different angles on things. And it's interesting how the attendance in the class has grown and grown and grown, and the interest has grown, and students come in with a much more thorough knowledge of food issues than was the case even just a few years ago. So I think this is a sign of social trends. It's a sign that people are caring more about the story of their food. They want to know where it comes from and who grew it and how far it got shipped and things like that, unlike they never did before. And the fact that there's so many people enrolled in this class is not surprising at all to me, given who the professors are, but it's also a very good sign of the times. So I'm going to talk about the nation's obesity epidemic, put it in a global context, and talk about food marketing in particular, but there's a broad concept that I'd like to get across that I'll come to in just a minute. When Michael introduced me, he mentioned that I direct a center at Yale called the Rudd Center. And the reason I have our website circled down there is for those of you who might be interested, we have a terrific website, rich with information on food policy issues. We have email alerts that go out to people when breaking issues are occurring, lots of judicial information about what the courts are doing, legislators are doing, et cetera, and it's very interesting. And we've also recorded a series of podcasts with people who have come to visit the Rudd Center, including Michael. We have, I don't know, 150 now such podcasts with really good people. So if you'd like to visit our web center, please do. So today I'd like to talk about the importance of defaults, and I'll introduce that concept. I'd like to talk about strategic scholarship and address the issue about whether universities are having the impact on the world they could, and to the extent they're not, what we might do about it. I'll introduce a concept of virtuous cycles of solutions to food-related problems, and then I'll end up talking about what I think is a very interesting topic about whether if you're going to deal with the obesity problem, is it more of a function of getting good food out to people or removing bad food from the system? And it deals with this whole issue of food access. I'd like to begin with this quote from Nelson Mandela, which I think says a lot about the soul of a society. And if you look at the way America treats its children with respect to food, it's a pretty dire picture. I'm sure in this class, or if not outside the class, you've heard the dire statistic that this may be the first generation of American children to lead shorter lives than their parents did, all because of poor diet, physical inactivity, and lifestyle problems that are driving things like obesity. And so there are several realities that we face. One is obviously the future depends on our children, but I think it's safe to say that children are being robbed of their future. Now, they're being robbed of their environmental future, but they're also being robbed of their health future. And there are parties responsible for this, and it's important that they be held accountable, that the conditions that are driving the problem be confronted in aggressive, assertive ways, even though it will take courage to do so. Now we're going to talk about food marketing as one of the issues today. And I'd like to start off with a little game of food trivia. And I'd like to get some volunteers. I'm going to need 8 volunteers from the audience to come up on the stage. And okay, come on up. Just anybody who wants to, come on up. This is a fun game. And you guys will all be good at it, I'm sure. So we're going to show you some marketing icons. Come on, just come on. You come on up, whoever wants to. Okay, thank you. Michael, I think you should be on one of the teams. So you come on up. Okay, we need some more. Okay, come on. Okay, come on down. You don't need to raise your hand. Okay, I want 2 teams of 4 people. So we've got one team here. Oh my God, look at this. Okay, over here. Okay, so let's get 4 people over here. Doesn't matter which ones. Okay, great. Now we're evenly divided, almost. Okay, now here's what we're going to do. I'm going to ask you to face the screen, and I'm going to show you a series of slides of food-related icons, and then you shout out which company these, or which product these icons are associated with. So if I showed you the Marlboro Man, you'd say Marlboro cigarettes. It would be like that. Okay, and so whoever gets it quickest will be the winner. And I'm going to show you a series of about a dozen of these things. And then interspersed in here will be pictures of people. So I'd like you to identify who the people are. Okay, so here's the first one. Okay, that's sort of a tie. You guys say Cheerios. You guys said Honey Nut Cheerios. So it's Honey Nut Cheerios, to be sure. Okay, but you got it pretty fast. Okay, now just pay attention to how fast these guys are at recognizing these things. Here's the second one. Flintstones are the Fruity Pebbles. There you go. Okay. Okay. Fruity Pebbles is right. Now what about this one? Okay, you guys got Trix. That was very good. Okay, you're exactly right. Trix. All right, now, and who's this? Okay, they got it. Leon Panetta, Secretary of Defense. Not as quick as Trix, but you got him nonetheless. Okay, next. What company is this? Okay, the Doughboy. You guys got that. Okay, what product is this? See, that's right. We have generational differences. This used to be called Sugar Crisp, but then they wanted to drop out the name sugar, so what it is called Golden Crisp. Okay, let's see which team gets this the fastest. Usually people are on this one pretty fast. Okay. Michael, you're surprisingly good at this. All right, Count Chocula is right. Okay. So who is this? Okay, so one person up here got it. It happens to be your mayor. So your mayor just got his butt kicked by Count Chocula. Okay, what about this? Okay, Frosted Flakes. You guys got that one. Correct. Okay, what about this one? Kool-Aid. Good, very good. You got that one. This one, of course? Okay. Very, very fast. Okay, then who is this? Okay. You know, I hope to goodness he didn't show up for this class, because how embarrassing would that be to... Okay, here we go, next. Fruit Loops, excellent, excellent. Michael, you're a little slow out of the gate on that one. All right, next.
Rice Krispies.
Okay, good, Rice Krispies you got. Okay, what about this one? You guys will recognize this one. Okay, you guys were on that. You guys were pretty fast too, that was good. All right, how about this one? Okay, Captain Crunch. Okay, then who are these people? What can I tell you? Captain Crunch just outdid you guys. They're crunchy too, you're right. Very good. Okay, let's have a hand for our contestants up here. All right, so obviously the moral to this story is how firmly ingrained these icons are in our psyche. And you think about somebody like Michael, who, you know, has written so extensively about the opposite of these things. It's still in his psyche. He still knows these things. We all do. It's just part of our upbringing. And so some people rue the fact that there's not much nutrition education going on in our country. Incorrect. There's a lot of nutrition education going on, but these are the people who do it. Not Michael and Alice, but the Trix Rabbit and all of those sort of characters. That's where people are learning how to eat for the most part. So there are a cascade of unhealthy behaviors that follow from that we'll talk about. But one thing I'd like to do is put this all in a bit of a global context. When I was a child, the obesity problem just wasn't much of an issue at all, and one certainly wouldn't have expected it in the developing world. If you look at data now and the projected increases in diabetes in the US, China, and India up to the year 2030, you find some very interesting statistics. So in the US, we're expecting a 37% increase. Now this is really pretty gloomy statistic because our base rates are so high. But in China, we're expecting this, and in India, we're expecting that. Now, of course, there's a denominator issue. They started with lower numbers. But even so, the populations are so massive that the world number of cases of diabetes is going to go through the roof because of what's happening in the developing countries. And who would have ever thought the day would arrive when the health minister of China would declare that overnutrition and obesity is now a more significant problem in his country than undernutrition and hunger. That day has arrived. If you collapse the same data across all developed and developing countries, here's what we're expecting in terms of diabetes. Now, almost 100% of this diabetes increase is caused by poor diet, physical inactivity, and obesity, not type 1 diabetes. And in my mind, the largest shame of all that the food industry has to stand up and face is the food colonization of the developing world. Now, you may be aware that the American tobacco companies got hammered in the United States with things like taxes, clean indoor air laws, and the like. And so about half the number of people smoke now than used to be the case. You can count the number of lives saved in the millions from those public policies that were put in place. The tobacco companies are more profitable than ever. The reason is pretty clear. It's the developing world. And so are the food companies doing the same thing? Are they sitting in boardrooms today saying, you know, the soda companies, it's just a matter of time, for example, that until we're going to be hit with taxes. There are education campaigns all over the country that are asking people to drink less soda. We're going to stall, hold off as long as we can, but we're going to make all our money in the developing world, and that's exactly what seems to be happening when you see statistics like this. And one of the papers in my career that I'm proudest of was a paper that I wrote with Kenneth Warner, who at the time was the dean of the School of Public Health at the University of Michigan, and one of the pioneers in the war against tobacco. And we sat down and sort of went one by one through the dirty tactics that the tobacco industry used, and then looked to see whether the food industry was doing the same thing. And it's remarkable how those two lists line up with one another. And you don't have to go any further than Richmond, California to see that. Fake community-sounding, grassroots-sounding front groups put up by the industry to fight the soda tax, as if there's a community uprising against this sort of thing, would be an example of what's happening. So we've got a pretty difficult situation, a world situation, not just in the US, and the question is, what do we do about it? And there are a lot of people doing a lot of different things out there. And can this all be brought together into a coherent whole? Is there a way to think about these problems that makes sense so we're moving ahead in other than random ways? And one of the things that we found helpful is to use a conceptual scheme that has to do with a public health approach to the problem, but an economic approach as well. The United States, because we're an individualistically oriented society, when we have problems that are health-related problems pertaining to behavior, like alcoholism, unsafe sex, creating AIDS, smoking, drug use, and things like that, and of course diet, we tend to focus on the individual as the first step. We try to do something that we give to the individual in order to help change their behavior. And so as a country, we default to giving people information or knowledge. We also might put in a little dose of motivation. So we basically educate and implore, And these are the ways we start trying to deal with the problem. Long, long before we ever get involved in policy. Go back and read the nation's, the way the nation has addressed the AIDS problem as an example of that. But basically every other health problem has followed this course, not with infectious diseases, but these sort of chronic disease issues. Now, in the case of obesity, we can medicate and operate too, but we hope that we end up with less of the problem. But this is a failed experiment by any standard because we've been doing this for about 40 years. Rates have gone up and up and up during this time. Now, this basic premise that you can give people information and that it will lead to wholesale behavior change at the level of the population is a testable one. You can just look at the data and see whether it's true or not. And you come up with some interesting things when you do that. So behind these orange boxes is the percentage of people in the US from 86 to 2000 who got the recommended levels of physical activity. Now during that time, a lot happened. There was a Surgeon General's report on exercise. The CDC, American College of Sports Medicine have released standards. Health clubs everywhere, exercise devices on TV. There really can't be many people out there who don't know that it's a good idea to exercise. But let's see what happened to the rates. Now these numbers are pretty discouraging, A, because they're low to begin with, and B, they're obviously part of a completely flat line. So it's not much of an argument for increasing knowledge. Well, maybe we're doing better with fruit and vegetable servings, the number of Americans who get the recommended fruit and vegetable servings. What about the fruit and vegetable servings in our children? Well, maybe we're at least protecting them. So we could show slide after slide of data like this that suggests that just information isn't enough. I mean, again, it would be pretty hard to find anybody in America who wouldn't know that it's a good idea to eat fruits and vegetables and to exercise. So the information, the knowledge itself isn't getting the job done. Why? Well, because the environment is conspiring in such powerful ways to bring people in the opposite direction. So what we're doing now is essentially educating and imploring, but again, this really isn't working. So the question is, can we wipe the slate clean and come up with a new way of looking at things? And instead of focusing on the individual, can we focus on the conditions that exist before the individual gets involved in the decision-making process in order to increase the likelihood of healthy behavior? And those of you who have any public health background will recognize this as Public Health 101, but again, I'll note some twists in it. So the question is, can you use environmental change, can you use the power of economic change, legislation, and the regulatory authority of government to create, and this is a term I borrowed from economists, optimal defaults. So if there are two words that I hope you remember today, it would be optimal defaults. Let me explain what that means. If you live in an environment that promotes healthy behavior, the likelihood that you'll be healthy goes way up. So let's say the air in this room were polluted. Now, we could allow unsafe air in this room and expect you to wear masks or figure out some other way to avoid the response to the contaminants. Or we can just have clean air. When you get drinking water on campus, it can be tainted water, and then you could have to boil it or take remediation measures, or we can just clean it up to begin with. So there's example after example like this in public health. We could let parents voluntarily immunize their children before they go to school, and you'd have a public health catastrophe in a week if you did that. We could expect people, we could implore, educate people to drive the speed limit, or we can do law enforcement and put airbags in cars. So example after example in public health where we step in to make the environment safer and healthier, and then people are healthier as a consequence. So you see where I'm going. We're going to get to some food examples pretty soon. But one great example of this is food in schools. The first frontier of the war on obesity were people making changes in school food policies. Research shows that if you have better foods in schools, kids eat better food in schools. If they have junk food in schools, they eat junk food in schools. And the companies, when they first started resisting these changes, said, oh, well, kids will just go crazy after school and they'll just eat more then and it really won't matter overall. Well, research shows that that's not correct. Kids don't eat more of it later on and they end up with a healthier diet overall. So you could try to put a nutrition education curriculum into schools, which I'm all for and people try to do, but it's hard to do that because who will pay for it? What part of the curriculum is it going to shove out of the way to make room for nutrition education? There are a lot of complications with this. Or you can just get in and clean up the food environment. So can we create optimal defaults in the food environment and have less obesity? Let me give you two examples of how powerful defaults can be. This one is from economists who study whether people enroll in pension plans. Now, you may know that when people get a job, many employers offer enrollment in a pension plan, and most people would consider it a social good if you enroll, because then you're investing money for your future. Some money is taken out. Some of you who aren't far enough into the job market to know this may not know how this works, but some money is taken out of your paycheck. It's put in an account. You're not able to touch it till you retire. Over all those years, that money grows and grows and grows. The employer usually matches it in some way, so it's free money for the employee. And then when you retire, you're less dependent on the state for medical care and other things like that. So most people consider it a good idea to enroll in a pension plan. But employers offer enrollment in one of two ways. One way, you're not in the pension plan by default when you get your job, but you're given the option of opting in. The other case, you are in the pension plan as the default, but you're given the option of opting out. So the employee has the same choice. You can freely be in or out. But just changing the default makes a big difference. So the employee has to do it. If the default is to not be in the pension plan, you get 50% of people enrolling. But if you simply change the default, you double it to nearly 100%. Now, you could try to educate and employ your way from 50 to 100%, or you can just change the default. Here's the most remarkable example I've ever seen, the percentage of people who agree to be organ donors, in this case in European countries. So to the left of that vertical white line there are 4 countries where the American type default is used, that you're not an organ donor by default, but you can agree to be one when you get your driver's license. And you can see what's coming to the right of that line. Countries that do the reverse, where you are an organ donor by default, but you can opt out. Again, the person has the same set of choices under both set of situations, but the default is different. So using the American model, here's the percentage of people you get to be organ donors. If you switch the default, you get this. Now, those numbers should take your breath away. Austria, 99.98% of people are organ donors. Now, if you're in one of those countries to the left, and let's say the government gave you $1 trillion, not that it ever would, to try to implore and encourage people to be organ donors, how high would you ever get those numbers? Maybe you could double them if you were lucky, but you'd come nowhere near those numbers on the right. So you can educate and implore if somebody were to come up with the money, or you can just change the default. So are there defaults in the food world that make a difference? And of course there are. There are lots of examples of disastrous defaults. Now, when I think back to when I was a boy, a Coke or a Pepsi came in an 8-ounce bottle. And I remember very well that when you were lucky enough to get one of those things, you drank the 8 ounces and the event was over. You didn't go and have another one or a third. You had one and then the event was over. Now the event isn't over until you've had 20 ounces. Now, it's not that we're dehydrated now compared to when I was a kid. It's that something exists called unit bias, in which people tend to consume whatever is in a bag or a bottle or a box. And as those have been systematically morphed upwards by the food industry, people are consuming more and more and more. And many of you probably heard about the action in New York City now that was spearheaded visibly by Mayor Bloomberg to limit portion sizes in the sodas sold in the city. I'd be more than happy to talk about that after I finish speaking today, because I think that's a very interesting example of government trying to get involved to correct that unit bias problem that people have. And you can see the other things are all very toxic factors, and that's only a tiny list. Now, there's some amusing examples of how bad the environment is. And somebody sent me some slides from the Indiana State Fair about some of the foods you can get there, so I thought I would share some of this. So here's where you can get chocolate-covered bacon. Okay, but now you can also get deep-fried butter. Can you believe that one? And then also you can get deep-fried Pepsi. And look what happens if you eat that stuff. You get that big white spot right on your face. This is not good. Also, think about how the food industry has tried to change norms with respect to basically every part of our eating landscape. Now, it was maybe 25 years ago or so, one of the fast food companies announced it was going to start serving breakfast. People thought they were nuts. Who would go to a fast food restaurant for breakfast? They were going to go out of business, people projected. And now, sometimes the cars are lined out to the street, waiting to get in there for fast food in the drive-in window. Some of you may have heard about Taco Bell's fourth meal campaign, the very deliberate effort by the fast food industry to encourage people in your age demographic to eat that meal after midnight at a fast food restaurant. So they used to have to be satisfied with lunch and dinner, but then they made it normative to have breakfast, and now they're making it normative to eat after midnight. And here's what they say, the meal between dinner and breakfast. There was a time when Americans did not eat in their car. Now, if an automobile company doesn't have a large enough cup holder, they lose business. And if you think about how our eating patterns, your eating patterns, are different from that of your parents, essentially everything is different. How many times you eat a day, what times of day you eat, where you eat, what you eat, the portion sizes of what you eat, and the exposure that you have to the marketing of unhealthy foods is stunning compared to what used to exist. But another example of defaults would be something like this. You may have seen this advance by Burger King. And here's one that I could hardly believe. Who knows what's baked into the crust of this pizza? Okay, some of you know. Cheese, well, that's old school. Hot dog baked into this crust. So you kind of want to laugh and cry at the same time, don't you, when you see this sort of thing? Now, what happens? Now, people eat these foods. Of course they eat these foods. They're available, they're attractively priced, and they're very highly marketed. What happens when those foods hit our body? What happens to human biology when these foods get ingested? Now, many people find these things taste good, and we get pleasure from them. But we get pleasure from a lot of things. Some of us like a certain color of an automobile, or we like a certain painting, or certain music, or whatever it happens to be. But we're taking these things into our body. We're not just looking at them and enjoying them. And something happens when we take them in. And some people have begun to wonder whether there's some biological hijacking that's going on with some of these foods that are so impressively processed in ways that thwart the body's understanding of them. And here's a metaphor that some of my students and I like to use when we talk about this. If you take the coca leaf in nature, humans can live in harmony with it. It's mildly reinforcing, people don't abuse it, and it seems to be okay. And this is probably true of most foods out there as well, if they're found in nature. But what happens when you process that coca leaf into cocaine, or you hyperprocess it into crack cocaine? Then things change. Then the body can't live in harmony with it any longer. And you just want people to stay away from it as the main public health intervention. So how different is that from taking a product like this, which nobody abuses in its natural form? People aren't going to overdo it, but you hyperprocess it into this. What's going on in the brain? What's going on in the gut? And could you make the argument, as I said before, that these foods are hijacking human physiology in ways that make it difficult to not eat them. And the coca leaf turned into cocaine, how different is it than this, which of course people don't abuse in its natural form, but you turn it into this, and then what happens? And how different is it than turning this into that? And there's a whole body of research now on the topic of food and addiction. I'm not planning to talk about that any longer today, but my colleague of mine and I just published a book on this topic, and it's a very fascinating body of science. Again, I'm happy to talk about later if you'd like. But you have to ask, what's happened to the modern food environment? And at one point, we could live in harmony with it. Our bodies were set up to deal with these things found in nature. But once they're processed and hyper-processed, then can our bodies handle them any longer? And if the answer is no, which seems to be the case, because as this food environment gets exported to country after country after country, there's a completely predictable rise in obesity, diabetes, and other diet-related diseases. So that experiment has been repeated in essentially every country in the world, and the outcome is always the same. So human biology does not seem to be able to deal with the modern food environment. Now, we could wait for biology to catch up, 10,000 years, 30,000 years, who knows how long it would take for evolution to help us out. Or we can try to change the food environment. Now, one issue that I wanted to bring up with you guys is some of you, now I know there are a mixture of undergraduates and graduate students here, and even some of the undergraduates will go on to other levels of academic training like law school or graduate school, medical school, or the like. And one question that I've always been interested in, because I've lived in an academic setting my whole career, is how much difference are we making out there in the world? How much difference are we really making when we get down to it? Now, we think we are. I think we're making a big difference. Of course, everybody thinks that, or else you don't get out of bed in the morning. But are we really making a difference? And in some cases, the answer is not as much as we could, and there are a lot of things we could do better. So this is an issue that we think a lot about at our center at Yale. And we've developed the term strategic science to discuss what we do. And those of you who are in graduate school will be familiar with the concept of programmatic science. This is a different kind of science. And I use the term science pretty broadly here to mean scholarship of any type. It could mean writing a book, it could mean doing a legal analysis, it could be doing any kind of scholarship at all, but isn't linked up to policy change. Is it really helping the world? And so we have to ask ourselves, how good are we at doing this kind of thing? Now, I'm going to make an extreme case just to make a point here, but one could ask, is science doing everything it can to make itself irrelevant to the world? Well, let's just say that were the aim. Not that it is, but let's say that were the aim. What would you do? Well, first, it would be really slow. You'd have to write a grant proposal, take a year to get the grant money if you're lucky. Might take you a year to run this complex study. You then submit it for publication. The journal takes 6 months to review it and accept it, and then maybe a year after that it gets published. So while the world is moving at warp speed, we're working at the snail's pace because we're socialized into accepting this and as part of our academic training. We would communicate it poorly. That is, we would only be writing for people who are in our subspecialty of our field. We feel important because the other 8 people who care about what we do reinforce us for doing that work, and we get invited to give talks and things like that, and that feels good. But how much difference does it really make? It would be unresponsive to real-world questions, but it would be responsive to scholarly-type questions. It would only be programmatic rather than strategic, and there would be conflicts of interest everywhere, namely that the industries that could benefit from findings of a certain type are paying scientists, and then they reliably produce things that favor industry. So all these sort of things are happening, and as an example, we're not really getting as much done as we could. We're not having so much of an impact on policy. So the way I think of it is most of us in academic settings do scholarly work, and we hope that the scholarly work ends up changing 3 things. We hope it affects other scholars in our field, but we also want to create social and policy change somehow. We want to make the world better. That's why we do this kind of work. And I would say we're pretty good at the first, but we're not very good at the others. And so we've tried to think about how to correct this problem. How can we link up scholarly work with policy changes in the real world, things that are going to mean something today? And so what we've done is we tried to look at the world this way, that when we do science, we need to think about who the potential agents of change are. Who are the people out there in the world who can take that information and do something with it? And can we connect better with them in order to get things done? And these are just some of the people in our field that would be relevant. These are all these people in that middle set of boxes there are much more powerful at making change than the people in the left box. But they're not talking to each other very much, and there aren't strong linkages, which I think there could be. And the metaphor I like to use is it's like a relay race. You know, when you're the third member of a relay team, you're going to hand that baton to somebody and expect them to take it and run with it, and then something good will happen. And so we do our scholarly work, we put it out there into the journals and things like that, but where does it go? What happens with it? The baton gets dropped almost all the time. So again, we try to correct this problem by creating what we call a virtuous cycle of solutions. So this would be obviously the inverse of vicious cycles. So here's what we do. We first try to identify the change agents. Who are the people out there in a position to do something? We try to develop strategic questions from that, and I'm going to give you a series of examples. We then do our scholarship. In our case, we're doing scientific studies for the most part, but also legal analyses. And then the most important thing of all is the communications if it connects back up with the change agents. And this is what we think of as this virtuous cycle. So we're very often getting ideas for scientific studies we can do from the change agents who aren't thinking scientifically. They don't say, we'll do a study with this group and that group and random assignment and that sort of stuff. But they will say, here's what my opponents on the other side of the aisle are saying when I propose a policy. And that very often turns into a little piece of science. And sometimes the science can be done very inexpensively and very quickly. I'll give you a California example of that. New York City was the first to pass menu labeling regulations. So restaurants had to post calories on their menus or their menu boards. California was one of the next government bodies out of the gate because there's a very strong public health community in California. And they proposed that this be done at the state level. Governor Schwarzenegger at the time demanded that the public health community cooperate in some way with the industry before he would agree to sign a bill. And the agreement one of the agreements that the industry extracted was to exempt drive-in windows from the requirement for the labeling. So I heard this about 10 o'clock one morning. Somebody from California called me and told me that this had gone on. So I canceled my noon meeting, I got a clipboard, I drove and sat across the street from a McDonald's, and I just counted how many people went in versus went through the drive-in window. And it was about 60%. Now, it was a crude estimate because, you know, I couldn't tell a dog from a person in the passenger seat from across the street, and there were all kinds of problems like this. So I put my graduate students on it, and in about 2 weeks they had done a proper study. 4 restaurants, breakfast, lunch, and dinner. They'd observed thousands of people, reliability estimates, and all that kind of stuff that ended up being published in a good journal, and it turned out to be about 60%. So from that point on, every time we heard that a legislator was going to introduce menu labeling legislation, we sent them that paper and said, don't let them get away with exempting drive-in windows. And in place after place after place, that California loophole didn't happen, because of that little study that took 2 weeks and cost about $50. So scientists wouldn't have said that was an important thing to do. Nobody ever said it was a gap in the scientific literature, but it came right out of this observation of what was going on in the real world. So I'd like to give you some other examples of this and talk about marketing, taxes, and labeling. First on marketing. We have been funded, our group has been funded by the Robert Wood Johnson Foundation to do series of studies on the marketing of food to children. And we did 3 successive reports, and you can find them all on our website, plus a number of other papers, looking first at breakfast cereal marketing, then fast food marketing, and then most recently the marketing of sugared beverages to children. I'd like to use cereal as an example. We published a paper in 2009 that you can find, as I said, online called Cereal Facts. It's a very detailed report. It took us about a year and a lot of time and money to collect the data on this because we had to get data from companies like Nielsen and other places about where kids were going on the web, how much TV marketing they were exposed to and the like. And we wanted to see how much marketing there was, who was being targeted by it, and what the nutrition quality was of the products that were marketed most aggressively. And you can think of it like this. Let's say we create 2 lists. On one list, we rank order cereals by nutrition value. And we put the worst cereals at the top of that list. And then next to it, we put a list of what's marketed most aggressively to kids. Let's see how those 2 lists coincide. So if you take the cereals, the best dozen cereals with the best nutrition scores, here's what they are. And you're going to see a lot of cereals that aren't that familiar to you. And we look to see how much marketing there is on television, on things called advert games, company websites, and then other youth websites like Nickelodeon. And at the best dozen cereals, there is exactly 0 marketing to kids. Now let's take the worst dozen cereals. Here they are. And let's see how much these are marketed to kids in those same venues. And you get that. So it's almost, you know, nobody would say that the companies are intentionally wanting kids to be overweight. But if they were, could you do it any better than this? You have a portfolio of products that includes healthy ones, but you take all your worst products and you market them most aggressively to kids. How much sense does that make? Why would they do that? Well, we'll come back to that in a minute. So in the context of this research, we did a strategic study. What we tried to do was to predict. When we released our reports, we wanted to get it into the press as much as possible so the public would find out about them and put pressure on the companies to change. And we tried to predict what the industry's defense would be to our findings. And we pretty much knew this because we'd been on panels and symposia with the industry people. And we knew what they were going to say was a 3-part logic chain. Part 1 was that eating breakfast is a good thing. That's true. Science will support that. Second, that cereal can be a good delivery vehicle for nutrients. Also true. But the third part is that kids won't eat cereal unless it has a lot of sugar on it. And hence, the cereal becomes irrelevant because they won't eat it. And so there was a paper published by 2 nutrition experts, one from Kellogg and one from General Mills, that basically said that. And they make this point that food isn't nutrition until somebody eats the food. And so kids aren't going to eat the food unless it has a lot of sugar. And then they say this too, ready to eat is a euphemism for highly sugared cereals. And that kids are more likely to eat breakfast if they have highly sugared cereals. All right, well, this is a testable thing. We can study this and find out. So we did, because we wanted to know in advance what would happen. So my colleagues geared up and did a study where kids were randomly assigned, when they were getting breakfast, to a low-sugar version of a cereal, like cornflakes, versus a high-sugared version of the same cereal, like Frosted Flakes. And the kids could put as much milk on as they wanted. They could put as much sugar, as much fruit on it as they wanted. And they also had juice, and they could drink as much of that as they wanted. What we found is that kids who got the low-sugar version of cereals ended up having just about what a child should have for breakfast. Plus, they put fruit on it to sweeten it up, and they got the nutrition boost from that. The kids that got the high-sugar version ate twice as much as what you'd like to see children eat for breakfast. So now you know why companies are pushing those high-sugared cereals, because kids overconsume them. Remember back to the hyper-processing thing. Is that part of what's going on here? And so we had this paper, and we published it in a good journal, Pediatrics, and we pretty much disarmed the industry from what their predictable defense was when our study came out, and that really helped with the public relations of all of this. And then not long after our paper came out, General Mills announced it was going to make about a 25% reduction in the sugar in its children's cereals. Now, we're only one of a bunch of people working on this, so we're not saying that there was cause and effect between our paper and them coming out with this. But we hope that in this case, the research ended up with the social and policy change through those particular change agents there that you're seeing in orange. And we consider this a real public health victory. Now, there's a lot more the companies have to do, and I'm about to show you that, but at least it was a change. Now, the companies are falling all over themselves to make the point that they can regulate themselves, and they don't need government regulation imposed on them. And so they say we're going to not market unhealthy products to kids. So again, it's a testable question. And we followed up our 2009 report, which had 2008 data, with another report that we published just last year to see what they'd done in the 3-year period and had they made any improvements. So we wanted to know, were they better off or not since 2008? So the top 10 cereals marketed to kids in 2008 were the ones that you see here. So 3 years later, now again, the context is the companies are making lots of promises that they're doing better. Only one cereal changed off that list, and number 9 got replaced with an equally bad cereal. And then there was a little juggling of position, but they're all still on that same list. So this doesn't seem to represent, at least in my belief, much progress. And more pressure has to be put on these companies to change. That's where the public can be so important and strategic scholarship can be so important. There's something called the Children's Food and Beverage Advertising Initiative, which is something that the industry does to basically put a friendly face on their marketing practices and say, we're going to do well by kids. And let's look to see how meaningful their criteria are. In the United Kingdom, there's an agency called Ofcom, the Office of Communications, which is their version of our Federal Trade Commission. They have pretty good marketing standards, pretty good nutrition standards for what can be marketed to kids on TV. And of American breakfast cereals marketed to kids, how many would meet the UK standards and be permitted to be advertised in the UK, again, using their standards? There would be one cereal. Now, the American companies, through their Children's Food and Beverage Advertising Initiative, what kind of cereals make their cut? And you get this kind of thing. So you really have to wonder whether the company's promises are meaningful in any way, or whether they're just a way to divert attention from the needed government regulation. Well, that's a question we all will have to address ourselves, and we may choose to put pressure on the companies or may not. But it's certainly a legitimate question to ask, and there are data that can be brought to bear to the issue. So that's marketing of breakfast cereals. Let's talk about sugar-sweetened beverages as another category of food. Sugar-sweetened beverages have become public enemy #1 in the nation's attempt to address obesity. It's not the only thing that people are targeting, but it's probably being targeted more than anything else. The companies that make these beverages, and it's basically Coke and Pepsi and a few other smaller players thrown in, especially through their trade association, cry foul with this and say, why are you picking on us? We're a minority of calories. There are a lot of other things contributing to obesity, so why are you picking on us? Well, there's a pretty long list of reasons why they're a logical place to start when you want to address obesity. Single greatest source of added sugar in the American diet, no nutrition at all connected with these products. The addictive properties of sugar, the addition of a known addictive substance, caffeine in large amounts in some cases, and clear proof of scientific harm. And the other factor that's not very well known, this poor calorie compensation, is an interesting phenomenon. I'd like to explain what that means a little bit. The body doesn't seem to recognize or understand that it's consumed calories as well when they're delivered in liquids compared to solid food. So let's say we do an experiment. We'll divide this room exactly in half, and as part of the experiment, this half of the room, you guys get your whatever lunch is usually for you, your traditional lunch, but you'd overdo it by 200 calories. And those 200 calories come in a solid food. It could be pizza, donuts, or ice cream for that matter. But you overdid it by 200 calories. This side of the room, you get your traditional lunch for you, but you overdo it by 200 calories, but the 200 calorie excess comes in a sugar-sweetened beverage. And then you're followed later on to see whether your body has recognized that you've had 200 additional calories, so you cut back in order to remain in calorie equilibrium so you don't gain weight. This side of the room will do better than that side of the room. And that is bad news if you consider that the percentage of calories that Americans have been consuming in beverages has gone up and up and up over the years. People just didn't drink as many calories as they now drink. And that poor calorie compensation, that fooling the body's understanding of calories, could be a real problem. And then in addition, the physiologists have worked out the metabolic pathways that link sugar-sweetened beverage consumption to negative health outcomes. So these sugared beverages are bad actors. Almost every public health expert would agree on that. What do you do about it then? What sort of public policies might you put in place? Well, there's a ton of stuff being done now around the country. It's really remarkable. But one of the things that we have been working hard on, and Michael mentioned this when he introduced me, is the idea of a tax on sugar-sweetened beverages. We introduced this idea the first time I wrote about it in a non-scientific publication was an op-ed in the New York Times in 1994. And I proposed a tax that'd be used to help address the obesity issue. Boy, did I get blistered from that. Rush Limbaugh beat up on me 4 or 5 times in his program. Wall Street Journal wrote a critical op-ed. I got hate mail, stuff like "we know where you live," you know, things like that was really pretty nasty. And I even got this, an anonymous letter from somebody who said, "Mind your own damn business, a pox on your house." So boy, I had to go to Home Depot, buy a pox detector. You know, what do you do with a pox on your house? So in any event, the idea sat around. Not many people did very much with this idea until about 2009. And several things came together then. Probably the most compelling of all the factors was the terrible economy. And governments needed a way to raise revenue. And what better way to raise revenue than something that would reduce healthcare costs, and you get a double benefit from it, and a tax on sugar beverages might fit into that category. But also in that year, some papers started coming out, and this was a paper that I wrote with Tom Frieden, who at the time was the health commissioner of New York City. He's now the director of the Centers for Disease Control, and we made a public policy case for taxing sugared beverages. We followed it with another paper, this time with the then health commissioner of New York City and the current one, Tom Farley, a number of nutrition experts, a health economist, and others, making both a public health and an economic argument for putting a tax on sugar-sweetened beverages. And the core, and some of you who take an economics class will recognize the term externalities, which means that there are people who are not involved in a transaction, but are affected by it. So if you live near a toxic waste dump, you're not involved in the financial transactions that created that dump, but you're affected by it. If you're not a smoker, but you're exposed to secondhand smoke, that would be an externality. And so we made a case for externalities in the case of obesity. And so back to the concept of strategic scholarship. So these were opinion pieces in a high-profile journal that got a lot of attention and publicity at the time, and it coincided with the bad economy, and politicians started to thinking about these things. And so the idea of the sugar-sweetened beverage tax got going. But there was more that we did in terms of strategic scholarship. So the economists working with us, Tanya Andreeva, did an elasticity estimate, which means she looked to see how high a tax would have to be in order to affect consumption of the product. And that becomes very, very helpful when you're starting to think about implementing a tax. Should it be a 2% tax, 5%, 10%, what should it be? And so we had all that worked out, which became very helpful to policymakers. She also did studies looking at how much revenue could be raised, and this turned out to be very helpful. And so if you go to our website, if you put in Rudd Center tax calculator, you'll pull up a little calculator where you can put in any state or any major city and a certain level of tax, and it will tell you how much revenue can be raised for that jurisdiction. And the tax that we've recommended is a penny per ounce tax on any beverage with added sugar, and that's what's being proposed in Richmond, California. 1 penny per ounce. Now, the nature of the tax becomes important. You can do a sales tax that's just a certain percentage of the cost of the product, but that has 2 fundamental flaws. One is that the consumer doesn't see the tax until they've made the decision to purchase it already, and then may not even see it because they're not paying attention to the cash register receipt. The other thing that a percentage tax does is it encourages consumption or purchase of large containers because you pay less per ounce for the large containers, and hence the tax per ounce would be less. So an excise tax of a penny per ounce means you pay the same tax no matter the size of the container, and you see the price increase on the shelf. And so a penny per ounce tax, 12-ounce can, 12 extra cents, 20-ounce bottle, 20 extra cents, 2-liter bottle, 60-some cents just in tax. So that's enough to get people's attention, of course, and to raise quite a lot of money. So the tax calculator, and let's use California as an example, turns up a table like this. So a penny per ounce tax on sugared beverages in California would raise more than $1 billion a year. So think about what you could do with that $1 billion. I mean, even if it just helped the state repair its deficit, that would be a good thing. But then if it were used for nutrition programs, healthy food access programs, all these sort of things, it could be a really very impressive thing. So this idea of a tax is appealing for several reasons. One is that it would drive down consumption of the beverages. The estimates are that a tax of this sort would drive down consumption by about 20%. You can calculate how many fewer cases of obesity you'll have, how many fewer cases of diabetes, and the healthcare cost savings. And of course, it raises revenue that, if used well by government, could lead to even further benefit. So the taxes are just one part of the picture now, but there are lots of efforts underway around the country to reduce consumption of sugar-sweetened beverages. And here are just some of the ones that I've noted. Efforts afoot to restrict marketing, lots of scientific reports and news accounts of this. The schools have been kicking these products out for many years now, and there's going to be national legislation kicking in soon. The mayor of Boston, followed by some other municipalities, has forbidden the sale of sugar-sweetened beverages on municipal properties. Oops. There are efforts afoot to restrict the practices of the food industry. Mayor Bloomberg's portion size restriction would be an example of that. Hospitals all around the country are refusing to sell these beverages there. Lots of educational campaigns. Some of you may have seen the one in New York City called Pour on the Pounds. Litigation hasn't happened yet, but I'd be surprised if it doesn't come around soon. I'd be happy to talk about that. And then, of course, taxes become an interesting issue. So I wanted to make the point that these sugar-sweetened beverages are a special category of food worthy of public health attention. And when you're talking about dealing with the obesity problem, they're a logical place to begin. Not the only thing you'd like to do, but a great place to begin. And one can do strategic scholarship in the service of these sort of initiatives, and that's what we try to do. We're trying to link up in real time, collecting data that helps the public policy process. So that includes thought pieces like the ones in the New England Journal of Medicine, elasticity estimates, revenue estimates, all these sort of things. Polling could be another example of things like that that could be very helpful. Now, I'd like to give you one example of an interesting victory that had to do with strategic science and a particular change agent who got involved. Some of you may have heard that in 2009, the food industry created a program called Smart Choices. What the industry did was it got together with itself, more or less, with a little scientific input, and created standards for what would be considered a nutritious food. And then any of the foods that met across the bar could be awarded this symbol, the Smart Choices label. So some people in public health were concerned that this might mislead consumers, that they might think that there were meaningful criteria behind it, and something that actually had this on it might be a healthy product. And people would assume that there was an objective body, like, so let's say, the government, putting this together, not that it was a self-serving industry program. Well, a particular person became an interesting change agent here. It happened to be the Attorney General in our state, Connecticut, Richard Blumenthal, who's now been elected to the Senate, but at the time was Attorney General. The Smart Choices criteria were such that products like these could be awarded the Smart Choices label. Now, Attorney General Blumenthal had been a real hero in the tobacco wars. He'd been AG of Connecticut for a long time, been very active on tobacco. So I wrote him a letter one time and I said, boy, you've done this great work on tobacco. Would you be interested in dealing with food and obesity issues? His office called back and said, yeah, we'll come down and meet with you. So I was surprised by this. I mean, I figured I'd be lucky if I got to meet with 3 layers down from the AG. But he came by and met, and we talked about this and decided that if we found a good issue to work on, it might be a fruitful thing to pursue. Well, then along comes Smart Choices. We get in touch with our Attorney General and say, here's what's happening. Do you think this would be worth taking on? He puts his lawyers on it. They figure that, yes, there's a case to be made for misleading and deceptive marketing by the Smart Choices people, and he launched an official investigation into the Smart Choices program. And in 2009, there were a series of dates over a 6-week period. This was breathtakingly fast regarding smart choices. So on September the 4th, the industry released the program and launched the program, right about September the 4th. A writer from the New York Times got tipped off that the industry was doing this, investigated it, and wrote a pretty critical article about the Smart Choices program. On October 14th, the Connecticut Attorney General launches an investigation. What he did was he held a press conference and he stood there with the cameras all over saying, he held up a box of Fruit Loops and he says, does the industry really think this is a healthy food, and is this what the citizens of Connecticut should be told? Now, we'd done all this marketing on research on the marketing of breakfast cereals, which we could then help them with, support their investigation. And he issued demand letters, which were just short of a subpoena to the companies and to other people involved in this process, basically following the money. The commissioner, shortly after that, of the Food and Drug Administration held a public phone call critical of the Smart Choices program. And on October 23rd, again 6 weeks after the program was launched, the industry closed it down. Now, there are a lot of reasons for this, but in my mind, it was the Connecticut Attorney General that was the key player here, because he, when he issued these demand letters, that got the attention of the industry. Now, what the industry could have easily held this up in court, far beyond the useful life of the Smart Choices program, but they didn't want the bad publicity. And they didn't want AG after AG in other states going after them and holding up that box of Fruit Loops. And so they closed down the program. So to me, this was a tremendous victory. Who cares about smart choices? But it was a shot across the bow of the industry saying, we're watching you. And a whole new series of players entered the game, the state attorneys general. They're potential change agents. The university community can help them, work with them, find out what the strategic questions are, and then you can really go places. Okay, so I wanted to give you those examples. Cereal, soda, and now the issue of the Smart Choices program is examples of change agents making a difference, but the university playing a very constructive, active role here, and I think we can do that if we think more strategically about the way we do our scholarship. So I'd like to end with a key strategy question, and I alluded to this in the beginning, and it's the question of more good food versus less bad food. Now, this issue of healthy food access comes up time and time again in discussions about obesity, childhood obesity in particular. And one of the key questions is, does giving people access to healthy foods work in dealing with obesity? Well, it only works is if those calories getting introduced into the system are met by calories exiting the system somehow and people eating less of the bad foods. And we have this implicit assumption that that may occur, but does it really occur? And if it doesn't occur, you could make the argument that we're just piling more calories onto people. Better calories, healthy calories to be sure, but could we make an argument that we're not helping the obesity problem, or maybe even contributing to it in some way with these healthy food access programs? With that said, there are a billion reasons to do healthy food access. Social justice, correcting inequities, there's the contribution of healthy foods to cancer, heart disease, lots of other diseases than obesity. So there are lots of good reasons to do it. I'm fully in support of it. But it gets brought up in this context of obesity as if it's going to make a difference when people really haven't tested it so much. And there's this non-articulated assumption that may not, in fact, be true. And this is only true if, as I said, you think of a pivot point, that it's like a seesaw, that when one side goes up, the other side has to go down. Well, it may not work that way. And here's some research that bears on this issue. A group from Harvard did a 20-year prospective study with a very large cohort of individuals to look to see what dietary factors predicted weight gain, excessive weight gain in people. And they found that the consumption of unhealthy foods was a stronger predictor of weight gain than was the protective factor of eating fruits and vegetables. So this sort of implies the bad food part of the equation is a more important player than the good food part of the equation, at least from this one study. A different way of studying this came from a group in North Carolina who looked at how close people lived to a fast food restaurant as a risk factor for obesity. And they found that how close you lived to a fast food restaurant was a stronger predictor of obesity than was how far away you lived from something like a supermarket that would have lots of fruits and vegetables. Now again, these two studies don't prove anything, but they are at least raising a flag that you'd want to study this and know it, because you could do things like healthy food access. Now, why do that? You're doing God's work, and you have no enemies. The food industry will be standing there cheering you along from the sidelines, if not helping pay for it, if you do healthy food access. Now, if that assumption were correct, that good food in led to bad food out, would the industry be standing there cheering or paying for it? Heavens no. So that's a bit of a tip-off, perhaps. So we need to at least ask that question. I think it's a really important one to do. And we have to ask which is more likely, this model or this model, that you decrease the junk and then good food may come in to fill its place. That would be suggested by programs in schools that clean up the food environment. Kids aren't going hungry in schools, they're eating the healthier foods. I mean, there's a little bit of resistance in the beginning, then they come around and start eating the healthier foods. So it's possible this is wishful thinking, and it's possible this is more likely, again, just in the context of obesity prevention. But it's an issue we have to talk about. Now, you've probably talked about or heard a lot about Michelle Obama's Let's Move campaign. I think she's terrific in this context. Passionate, articulate, committed, intelligent. Everything about her approach to this, I think, has been good. But one of the major areas of emphasis is healthy food access. And they're not talking about healthy food access for cancer prevention or social justice reasons. Let's Move is all about childhood obesity. So does that make sense? Well, yes, it does make sense for political reasons. And again, you don't have enemies. If they're out there talking about soda taxes, oh my God, you can imagine what would happen to them then. So there are real political realities that these folks have to deal with that I completely understand. But we do have to ask ourselves this question. So I'd like to end with the following comments. Again, I'm very happy to be here. You guys are our hope for the future. There's no question about that. The fact that you're so committed to health and nutrition issues is very impressive. The fact that you care about food systems is very impressive. And thank God for people in this world like Michael Pollan and Alice Waters, because they've raised the banner high, they've done it in beautifully articulate ways, and it really, really has made a difference. The world's changing, there's no question about it. The size of this class is an example of that. And I think there's every reason to be hopeful in the future, but boy, is there reason to be concerned. If you take the three major world food problems, hunger, undernutrition, think of them at corners of a triangle, if you will. Hunger and undernutrition at one corner, obesity and overnutrition at a second corner, and the third would be the environmental catastrophe created by modern food production. Every one of those is something to really worry about, and if you put them all together, then you really have to worry. And nobody has seen the whole picture for the most part. People might see one part of the triangle, maybe two, but it's extraordinarily rare when people look at all three. That's what's happening in a class like this, and thank goodness for it. Thank you very much, and I'm happy to answer questions.
Thank you. That was terrific. You have a gift for making radical ideas seem common sense.
Thanks.
Couple questions?
Sure.
I just want to, you've got a lot of supporters of this idea of a soda tax in this room. Just so you guys know, it came out 68% in favor, 15% against, and 17% not sure. And maybe some of those not sures are more sure now. You know, even President Obama voiced support for the idea of a soda tax early in his administration. The fact is, and I remember having lunch with you and you telling me back in 2009 that these things were going to, you know, be all over the place very soon. They're not yet. The contest in Richmond is, you know, in trouble. They're spending $1 million, I think, plus to stop it. Why haven't we succeeded? Why haven't voters instituted one of these taxes yet?
I'm just going to give you my intuition on this. I'm not sure I'm right. But I heard somebody gave a presentation the other day that said that the anti-soda tax campaign by the industry has been $1.2 million. And
this is in Richmond.
In Richmond.
Yeah.
For that little community, $1.2 million. And the amount of money that's been put toward it is $25,000. So it's essentially 100 to 1. You know, I mean, the numbers are just astronomical. And so I think what we're seeing is a repeat of the cigarette tax phenomenon, that the industry won the first skirmishes, and then as the idea became more normative and people began to get used to it, then they started to pass. And once you get it, it's hard to go first, it's easy to go second. And so somebody will do it first. Philadelphia came really close to passing a whopping soda tax, twice the size of what we're talking about. And once one of those passes, then I think the floodgates open and you're going to see a lot. Not as fast as I'd hope, but I think in a very accelerated pace compared to what we saw with tobacco, which took decades. I think this is going to happen in a much shorter period of time.
The argument against it is that it is, in a community like Richmond, is that it's regressive. That poor people will be affected more than affluent people who can just shrug it off. And in fact, there's a racial and a class component to the arguments being made by the soda industry, which is actually taking the populist high ground on this issue, incredibly. But what's the response to that? That, I mean, it is a regressive tax.
Yes. So is tobacco. And what happened with tobacco is that things like lung cancer and heart disease were regressive diseases, and so is obesity. And the segment of the population that benefited most from the cigarette taxes were the poorest people because they didn't have health care, and the avoidance of these terrible diseases caused by tobacco and then now by obesity would affect that population in the best way. Plus, it's not like there's not an alternative. I mean, there's water, and I just did a little quick back of the envelope calculation and figured that a family of 4 would save, I forget what it was, but it was like $2,000 a year if they just switched from soda to water. And so, you know, this idea that it's regressive is irksome to hear, especially from the industry, when you think about the targeted marketing that they do to some of the poorest segments of the population.
The other argument, of course, is personal responsibility.
Right.
That whole framing of the issue. I mean, that, you know, there are many people who drink soda and don't have any problem.
Correct.
And they're being penalized. And so, what's wrong with that framing of the issue? I mean, that is the industry's chosen argument.
Yeah. I don't see any reason not to start at that place, and you try it out, and if it doesn't work, then you do something else. And at some point, as a culture, we believe that health problems reach a certain level, that we give government permission to act on our behalf, or we mandate them to act on our behalf. So we gave government permission to put in sky-high tobacco taxes. We give government permission to require the immunizations, airbags in cars, clean air, clean water. I mean, we do this in a ton of places because the problems reached a certain level, and we said we can't put up with these anymore. So everybody has to answer that question for themselves. Are we there with obesity? 2/3 of adults, 1/3 of children, massive health care cost. We all pay for about half of it through Medicare and Medicaid. So is this just to the point now where we're going to say, okay, personal responsibility was a good thing to try, but it didn't work, and now we have to clean up the environment, government needs to go to work.
Okay. Let's take some of your questions. We've got a few more minutes left. Anybody have a question for Kelly?
There's one over here on your left.
Sally.
My name's Sally. I'm a public policy graduate student. And I love your work on taxes, and it's one of the things that got me interested in working on food policy issues, so thank you.
Great.
And I was hoping to hear your opinion on someone who's been, on some ideas that have been put out there on changing default options. There's a woman named Deborah Cohen at RAND who's been writing a bunch about regulating the food retailer. And so getting restaurants, supermarkets to do a lot more to shift default options in a way that would get people who are trying to purchase healthier options to purchase healthier options without changing prices. So that if people still really wanted soda, they could find the soda and pay the same amount for it, but it would be in a different place. And so an example might be only having the soda like behind a couch
Okay. Could you guys hear that? Okay. All right, so I'll paraphrase it quickly. This person raised the correct point that there are a number of people in the field who are talking about changing default options in the retail setting. So restaurants or supermarkets, are there things that could be changed? And the question is clearly yes. How many parents would love to have a candy-free checkout aisle, for example? What if you put nutrition criteria in for what could be at eye level for children? Could you mandate that you could only have healthy food in those end-of-aisle displays? What about the restaurants, as you said? Could you mandate that the healthier items appear first on the menu? And research would support every single one of these things. So the question is, how do you get them done? And so you could ask the institutions to do them voluntarily. That becomes tricky because the profits are highest on some of those, the worst choices. And also people overdo it and eat more of those sort of things. So the supermarkets, I don't think are likely to do this voluntarily. They might do some labeling things, but when it gets down to, you know, what's at eye level for kids and stuff like that, that's very precious real estate, and I don't think they're going to turn that over. So then the question becomes, does government have the legal authority to do it, to mandate these sort of things? And we've just written a paper, I'd be happy to send you on that. And it turns out that government does have considerable authority to do it. Now, they'll have to have political will to do it, but the authority seems to be there. And Mayor Bloomberg's restricting portion sizes was probably the first shot about that.
What authority is that, though? That's the thing that's been most curious to me. I didn't think the mayors had the power to prohibit a certain size coffee cup,
well,
or a soda cup.
It depends on what the mayor. It's not the mayor's authority here. This was all done through the health department in New York City, and health departments, city health departments, tend to be given their range of authority by the state, and it so happens that New York City has considerable authority here. But it still has its limits. So Mayor Bloomberg's proposal specifically was that in the places where the city has jurisdiction, no container for sugar beverage could be over 16 ounces. But they only have authority in restaurants, in food carts, and in movie theaters. So you could go in a restaurant and only be able to get a 16-ounce cup, but go next door to the 7-Eleven and buy whatever you want. And so you'd want the state coming in and acting at the same time the city does, but the city only has limited authority, and that will vary from place to place. So God knows what authority Berkeley would have, or San Francisco, or whatever. It would depend on the state.
Okay. Question over there, yeah.
Uh-huh.
Does that $1 billion in any way offset it? It becomes part of the general revenues. Is it an inadequate amount? Should it be allocated to the rest of the health costs?
Okay.
And in fact, should we be designing a sugar tax that would be allocated to the medical, to all the medical costs?
Right. Okay. Very good question. The question is, how broadly do you apply these sort of policies like a tax? Now, just doing a tax on sugared beverages is not going to turn around the obesity problem. You might do this and really not even get very much of a noticeable change, because you have to be doing a lot of things at the same time. But again, you have to start somewhere, and this would be a logical place. The reason that I haven't chosen to focus on a broader tax is you need to get public support for these things, or else you're not going to pass them. And people get it. They get soda. Whereas if you start applying it to other foods, then it becomes a little less clear in their minds. And so I think the way to get the whole tax thing established as a concept is to focus on a category of foods that people get, no nutritional value, no redeeming value at all, heavily marketed. People understand that there's sugar water that's contributing to obesity. But once you did that, then you might very well want to look to where the science is also strong, what other categories of food might be taxed, and then you're on to other possibilities.
Yes.
Yes, sugars, it would be anything with added sweetener. So NAFTA lawsuits, I haven't heard of anything like that proposed. Right. Right, it would certainly bring that up because some of the cane is grown elsewhere. It would include anything, I misspoke, it would include anything with caloric sweetener added, not non-caloric sweetener. So that would include high fructose corn syrup, sugar, fruit juice concentrates, things like that. Okay.
So what about non-caloric sweeteners? Because I know there have been studies, maybe not linking that directly with obesity, but maybe like carcinogenic effects.
Okay, good question. The question is, what about non-caloric sweeteners? The reason that we don't propose a tax on the non-caloric sweeteners is then again the public gets confused and people don't necessarily recognize diet drinks as a bad thing. And so if you want to get the tax concept out there, then just restricting it to sugar-sweetened beverages makes sense. With that said, there are two fundamental concerns about the non-caloric sweeteners, the artificial sweeteners. One is whether they're safe. With things like aspartame that have been around for a long time, if they were having negative consequences, I think we'd probably know about it by now. But who knows? Maybe it just takes decades of exposure before these things set in. And then there are other newer products like Splenda that hasn't been on the market that long, and you wouldn't know if it takes chronic exposure to produce negative health. So I'd say the jury is still out on that one. And then the other question, the one you raise, is do they really help people control their weight? And the literature on that is all over the place. So at some point, the science on these things might become clear enough where you'd either say a tax is justified or not. But I'd say right now the literature is mixed, and if you want to propose something as controversial as a tax, you want to be on as strong a scientific ground as you can.
Will you just say a word about litigation? You alluded to it. Are we going to see a moment, you think, where there will be litigation against soda companies as we saw with tobacco companies? And what would be the necessary conditions before that could happen?
Well, there already has been. There have been a few lawsuits filed against the fast food companies for health consequences, filed originally in New York State. But there were a variety of reasons those didn't really go anywhere. The question is, could litigation have legs? And I think the answer is probably yes. And there's good reason to think about the possibility. The lawsuits against the tobacco companies were incredibly influential. Now, not the individual plaintiffs' lawsuits, you know, that my spouse got lung cancer and then we're going to sue the industry, but the attorneys general collectively went after the tobacco companies and resulted in this master settlement agreement that really cost the tobacco companies a lot of money and led to some other beneficial changes in public health, although it's somewhat controversial. So could the state attorneys general go after the food companies and saying, listen, you know, you guys, you're costing our state so much money in healthcare cost, soda, fast food, whatever it happens to be, and we want to recover some of those costs. There seems to be pretty good legal ground for that based on what happened with tobacco, even though it's a harder case to make. You know, with tobacco, there was just cigarettes. There was one product, and it was pretty clear that's what was causing lung cancer. But everybody eats a lot of different foods, and to specify health damages from one food or one company would be pretty hard. But I think it could probably be done in some way.
Okay, we have time for one quick question. Yes, in the blue shirt.
Yeah, what I think you'd like to see is these things happening simultaneously, that there would be efforts to increase healthy food access and to decrease access and marketing of and promotion of the unhealthy foods. And this way, as people got weaned off the unhealthy foods because the policies were pushing them that way or they were just doing it on their own volition, then there would be opportunities to eat healthy food. And, cooking classes and, farm to school and all those sort of things are a really good idea and would be wonderful to have in place if the bad food starts to decrease. But I think in order to address the obesity problem, hoping that healthy food access will solve it, I don't think is going to get us to the goal line. probably nowhere near until you go after the unhealthy food too.
Great. And with that, we're going to wrap up. Can we thank Kelly for his presentation?
Thank you. Thank you.